Welcome to Navigating Hope, your compass to health empowerment. I'm Dr. Jamie Hope, steering you through healthcare, overcoming overwhelm, personal goals, and emergencies. We'll navigate the healthcare maze with actionable insights and real-world advice, unlocking the secrets to a healthier, more vibrant life. Join us to take control of your well-being and make informed decisions for your health and your future. Stay with us as we unravel the mysteries of medicine, wellness, and life's unforeseen challenges, helping you bypass the ER with a dose of knowledge. Stay tuned till the end of the episode with a recap of your actionable insights and a free gift. Let's chart a course to your well-being together. All right, welcome back to another episode of Navigating Hope. Joining me today is Brooke Barden, a licensed clinical social worker with over 2.5 decades of experience helping individuals and families navigate some of the most difficult mental health journeys. She's the director of clinical quality assurance at Victory Starts Now, where she leads programs that support individuals living with severe and persistent mental illness. And when I say she's doing life-changing work, I mean it. From supervising her clinical teams to helping people in the criminal justice system, she has seen it all, and she has so much to share. So today we're going to talk about what it really looks like to support a loved one with severe mental illness and how to navigate the very complicated mental health system and where to find hope even when the road seems long. Brooke, welcome. I am so excited to have you here with us today.
Thank you for having me. I'm really happy to be here.
So let's talk origin story. You sure picked a complicated and challenging field. With what made you want to get into this in the first place and helping this underserved population with the severe and persistent mental illness?
That's a great question. I think that my grandmother and that side of the family has always been helpers. My grandmother used to do these crazy midnight madness shopping sprees at Myers in the Midwest, where they would buy ridiculous amounts of canned goods and then take them over to like the various subsidized housing complexes and give them away. I just think my whole life I was around people who, even though they maybe weren't financially successful, were constantly giving what they had. When I was, around somewhere between 12 and 14, my cousin, who was my own age, he was actually diagnosed very young with schizophrenia. He was experiencing, auditory hallucinations and paranoid delusions that my aunt and the family were trying to poison him. He wasn't able to eat food unless it was coming out of a package. And I just remember it kind of fascinated me because he was my age. And it was so different than what I was going through as a young adult or teenager. I think around that time, I also watched the movie Sybil, which was so fascinating. And it was like my hook. I started just getting into as much psychology as I could. So it's kind of always been my passion since around then. In college, I always knew I wanted to work with schizophrenia. And I was really lucky because I went to UC Santa Cruz, and there was a locked subacute facility in the neighborhood where people who were like, I think Napa was kind of closing around that time. And so people who'd been in Napa State Hospital for years were being transitioned to the next lower level of care. And so I was really lucky to be able to see people where maybe that really was the lowest level of care they were going to get to live in. And then occasionally, we'd have people who'd be with us for a while and we'd be able to transition them into boarding cares and places like that. But that really inspired my research and where I went to grad school, and then just eventually the area I wanted to work in.
I think that is so amazing. So you got to see these beautiful examples of your grandmother and people. I have found this, people who don't have a ton of resources are still so generous. I just, over and over, I see that happen, and I love it. And this could have gone a lot of different ways with a cousin with schizophrenia, but you went the compassion route. And how can I help and how can I make a difference? I love that.
Yeah, it was really fun in college because we were pen pals. And he would send me letters and draw pictures, and then I would send him letters back. And it was really, I saved all of them. So someday I'm going to look back on them, and they're really fascinating.
Oh, I mean, yeah, what an inside look into that world, and for him to have that trust with you to share. That's really special because it helped you become the amazing clinician you are.
Yeah, I definitely think the personal experience adds to it because you know what it looks like and how it impacts a family as well as a person. I think having a diagnosis that's going to be chronic throughout your life is can really be taken as like a prognosis of doom, is what they call it. And it doesn't have to be. And I think watching people's journeys as they recover through that and process that is really amazing, and you can really influence the outcome.
And that those are the kind of things that make all the difference.
Absolutely.
So we want to talk about community and family and all of that, but first let's just talk definition because mental illness could mean a whole lot of stuff. Is it
Mhm.
seasonal affect disorder for those of us in the Midwest when it gets cloudy and gray and cold all day, versus that? So what is a severe and persistent mental illness compared to maybe some of the more mainstream things people are familiar with?
I just want to say we get seasonal affective disorder in California too, just maybe not the same extremes. Serious and persistent mental illness would include, schizophrenia or schizoaffective disorder, bipolar disorder with psychosis or psychotic features, more serious recurrent major depressive disorder, or some more of the severe anxiety disorders that are going to last. They're not illnesses where you might have one or two episodes. They're something that's going to be consistent throughout your life. So maybe you have a depressive episode that's really severe, requires hospitalization, and then you do well for a while, and then maybe it flares up again. And so it takes ongoing management and support to kind of keep yourself stable. Similar to something like diabetes that would be chronic and the more severe cases of that.
Okay. So in a lot of these illnesses, is based on the current paradigms and all of these things, there's not a cure. It's not something you're going to outgrow or fix. It's something that you will have, but there are ways to successfully manage it compared to unsuccessful management. Was that accurate?
Yeah, yeah, I would say that.
Okay. All right. And so I know you work closely with families. And what I love about what you do, because of course you want to support the patient, the person who has the severe and persistent mental illness, they have their own struggles. But I really love your take on not just the patient, but the people around them. So talk about how you view that.
Yeah, I think like the family is extremely important. I think if we can support a family to not only take care of themselves, but learn about the illness, learn how best to support their child or their brother or their sister, you're going to have the better outcomes for the individual who's diagnosed with the mental illness. Studies actually point to, like, for instance, the expressed emotion and the lower expressed emotion that a family displays when somebody is having symptoms or slips up or maybe has a relapse or something, the better the outcomes, the less hospitalizations, and the more severe the episodes are. So I think it's vital to be able to support the families. I think, like, if every mental health program could have a therapist just designated for the family members, the individuals that they serve would be much better off. So we do try to include the families in our work that we do. We might do a family session with them alone where we just, provide psychoeducation, really talk to them about the history of the individual, help them understand some of the symptoms, maybe not take it personally when certain things happen, and then how best to approach, okay, when they're experiencing this, this approach might actually escalate them, but this other approach might help them calm down, and you might find some more success with this. There's also, certain medications that people can take where they're maybe not taking them regularly, but they're taking them when there's like a flare up or some sort of trigger that's happening. And the family might be the one that kind of is able to start pointing those things out, just like the team would be, of this might be that time to use that PRN, where the member, so we call them members or participants, where the member may not realize that this is the time to take it. They might be in the heat of the moment. And then slowly they start learning, like, okay, yes, mom, you're right. I should take this. And it helped last time. So now I'm telling you, down the road, now I'm telling you I need that right now. I'm getting, I'm feeling paranoid, or I'm feeling anxious or agitated or something. I also think, like, the more support we can give the family, the better they're able to manage their own stress, and they're going to be more effective in their responses. They're going to be more patient and able to tolerate different situations that might come up. We also do, I don't think I mentioned it, but we'll also do family sessions before individuals go home. So we're really lucky because we're able to link our participants to permanent supportive housing that they can keep. They pay 30% of their income, whatever that is, whether it's zero or whatever, and they can keep it for the rest of their lives. But a lot of individuals will still choose to go home to their family, and before they're going home, we really want to make sure that's going to be successful. A lot of our individuals have been chronically unhoused before. And so we want to look at with the family what got in the way of them living with you before, what led to that falling apart. And then the member too, what did you see as the barriers to you staying there? And okay, what's going to be different this time? You're doing really well this time, but like in the past, you've gone off medications or you've started using. So how do you want your family to react to that when that starts happening again? Do you want help? Do you want them to just let you move out? Do you want them to help you get into some sort of substance use treatment or support you in talking to the doctor? How do you want to receive that feedback from mom? In the past, when she's told you you've blown up and you've, whatever's happened, you've gotten upset with mom. So how can she tell it to you in a way that we plan out ahead of time, so that when it comes up, you're prepared for that and she can remind you? And then vice versa, like maybe these are the expectations mom has. What are the expectations you have? Almost like a roommate agreement that you might have with somebody. And then, sometimes that might need to be in writing. And sometimes you might talk to them about, your loved one is really stable when they stay on their medication. I've noticed, at different times in their lives, they've gone off, and that's when they get arrested or in the hospital. What do you think about them staying on meds? And that family meeting has actually allowed us to educate. There was a brother I'm thinking of where he was like, well, he's finished the program, so he's done. He doesn't need them. He's telling me he doesn't need them, so he doesn't need them. And that education, he was able to see, like, wow, okay, that's why he's doing well. Okay, yeah, I want him on the meds. I don't want that to happen. I have kids in the home and he does do very poorly. And so we were able to get a plan together. It's also really important that we try to make sure families have all the resources they need should something happen that maybe they can't manage. So is that the local psychiatric emergency response team? Are there behavioral health urgent cares in the area where if they need a refill, they can't get in with their doctor, they can go, or they can stay overnight? In some areas, there's like alternative to hospitalizations, which are safe places specifically for people experiencing a mental health episode where they can stay voluntarily, so it's safe and they can get support while they're there. So what are the resources available for the family to use and for the member to use when maybe a crisis comes up?
I love how you have this like really wraparound approach because, helping the member know, okay, you feel better on your meds. When things don't go as well, how would you like your family to handle that? To ask those questions in advance. And so they're prepared, even like a roommate contract, even in writing. So they're prepared because there's a decent chance these situations are going to occur.
And if they don't, great.
Yeah, no, it'd be better. It'd be lovely. And that care for the family so that they know what to do and to, how to set boundaries. That self-care isn't selfish. You can't pour into somebody from an empty bucket. And that,
Absolutely.
I assume that's sometimes how these situations go awry in the first place because the family just gets burnt out and exhausted. Have you seen that?
Absolutely, yeah. And sometimes the family wants to do everything that the the person is asking or needing. They don't want to upset them. They don't want them to suddenly, move out and become homeless again. And in some of those instances, it's maybe not in the best interest of the individual. And so, yeah, setting the boundaries is really important, not just for the family member, but also for the member. They need to, in their recovery journey, learn to take some, self-responsibility for the choices they're making and what's happening to them. I always try to tell them, and I tell the families this too, you're not always going to be alive. Like you need to prepare this. Your loved one needs to be able to live independently when you're not here. And so, is what you're doing going to help them in that? Or is that making them more reliant on either a provider or on you? And if it's making them more reliant on you, you need to really think about, who is that serving? Is that serving you, or is that serving your loved one?
Yeah, that's really key because you can get into some codependent relationships and where people are just keep reliving this same cycle over and over and over
Yeah, it
versus
becomes their
knowing,
identity. Yeah.
yeah. And I like what you said about knowing your resources. I mean, where I'm at, we have a lovely nonprofit organization called Common Ground. They have a behavioral health urgent care. They have crisis centers. They operate the 988 line. Just so lots of stuff. And as an ER doc, I know what's in my community because I need to know where to refer patients.
Absolutely.
But for people listening to this, really taking the time to know what is available in your community. There's the National 988 Mental Health Crisis Line, but there are resources. It does vary quite a bit,
Mhm.
county to county, state to state, but they're knowing what is there to help you and your loved one is huge.
Yeah, and most areas have the National Alliance on Mental Illness, and that is for families. It's provides there's a family to family service they do. They have support groups, they do advocacy. They're an excellent place for families to start. I also highly recommend, families doing their own therapy. It can be difficult for them to deal with, and you really, that extra support makes all the difference.
Oh my gosh, that's huge. And you're trained in so many different things. I mean, the depth and breadth of your clinical training, I mean, EMDR, your trauma informed care. Can you share a little bit about those modalities and how they can help people, or just helping people find, like, how do you know what is the right modality for you?
I think EMDR can actually be used in so many different situations. However, it's primarily used with trauma, and it helps you reprocess traumatic memories that kind of get stuck. And in in other situations, you're able to process things and take out the adaptive information. But sometimes when there's trauma, it kind of gets stuck and you kind of just keep reliving that. And the effective, like, I'm trying to think of the term, the arousal and the response is so extreme that you're not ever able to take out that adaptive information. You're kind of going back and forth into fight or flight. So it helps you reprocess it in a way where it doesn't create that same distress when you're having to think about it. I've seen this be really effective with some of our individuals that have had a lot of trauma. You can also use it around, auditory hallucinations are pretty scary and pretty distressing. So you can also use it around that. We do use more other approaches with our folks, but it can be extremely effective. So we use a lot of harm reduction and motivational interviewing. We also, like you mentioned, we use trauma informed care. And that can be, that's really something that is key and can be, there's definitely things that you don't always think about that are really important as you get to know somebody to implement. I once worked with a young woman who experienced human sex trafficking. And when the coffee pot went off in the morning, she knew she was going to be assaulted and have to go to work. And so when she'd come into the office, we would, like, there would be no coffee, there would be, like, everything would be cleaned out so that the smell wouldn't trigger her. And we had to she slowly would get exposed to that sort of thing in her life. But until she was comfortable with us, we went out of our way to not trigger her. The men in the building wouldn't well, first the first few months, like I think we would make them all leave, and then slowly somebody would just be sitting there and make no eye contact until eventually she was able to, be more. I think eventually she was able to talk to them, but it takes a while. And in our houses, we have individuals who they might have grown up, a lot of them grew up in situations where their families fought a lot, and they had to be the mediator or the person keeping it calm and de-escalating. And so I have a gentleman that he was really awesome to work with, but he would loud noises and yelling, and particularly somebody opening the door too quickly would really trigger him. We had people who they have to do rounds at night, well, all the time, to make sure they're okay and everybody's still there. And there was a staff member who wasn't really aware of how fast and hard he was opening the door. And he would get really triggered, and he'd have to like sit in the shower in the middle of the night with the water running over him for like 2 hours to calm down. And it just took like, hey, do you realize this is what's causing this? I need you to really be gentle when you're opening the door. And being able to talk to people about what are your triggers and what does set you off or cause you distress is can be really important.
It is. You're so good about, I like the individualized approach, because what triggers one person doesn't trigger another. And even for those of us just that don't have severe and persistent mental illness, that haven't been trafficked, we all have our own triggers, right?
Yeah.
And we should all take the time to learn what they are and share them with people so they know here's how to not do that. So, you individualize and you meet people where they are. I just, and so in addition to that, so now you're working with people who have unhoused, severe and persistent mental illness. You also work with people who are felony incompetent to stand trial. So now we're talking about like that, adding on now the component of crime in addition to
Well,
everything else.
I really like to look at it as you're serving the population of severe and persistent mental illness. 70% of people with schizophrenia will experience incarceration at some point. And the folks that we work with have all of them were experiencing mental health episodes or substance use episodes with a mental illness when they were arrested. So I don't like to view it in that way. I think all of our folks have been extremely traumatized by the police and being in jail. And sometimes the police get sick of maybe hospitalizing and seeing them come out, and they think like if they're in jail they'll get treatment. And I think there's sometimes where it could just really go either way. Like they could choose to send them on a 5150, or they could choose to arrest them. And so yeah, we do serve people who the various different levels of outpatient mental health services don't capture, and they do tend to, they are forced into treatment because of the arrest, but they're really no different than anybody else.
Well, it's just, yeah, it's a maladaptive response to what they're going through. And you can see that continuum, and you continue to look at all of these people with compassion. You said you like the toughest people, give you the hardest cases, the one nobody else wants to work with. Why do you want to work with these people?
I think they're the most vulnerable, and people don't enjoy working with them. So I think there's the biggest payoff and the biggest reward. They're not used to people empathizing with them or validating them. They've probably had really poor attachment growing up, or they've experienced a lot of hardships, and you can make a huge difference. And even small differences in their lives are huge differences. But if you build that relationship with them and you get them to trust you, you might be able to get them to try a medication they'd never be willing to try, or some other coping skill that maybe they wouldn't have done before. And those are, I don't know, it's pretty remarkable to see their journeys.
I mean, that is so remarkable. These people who just are, like you said, they're so vulnerable. There's so much need and not enough people who can look at them with that compassion and empathy instead of judgment. And what you're doing is just truly transformative work.
And as I'm talking about it, I'm thinking like one of the biggest things I think we do is the healthcare. Like a lot of people who have severe and persistent mental illness and who've been unhoused haven't been to doctors in so long. And they're used to doctors thinking everything is either a symptom of their schizophrenia or a side effect of their medication. And so I think one of the biggest things we get to accomplish is advocating for them. Like, no, the psychiatrist needs this ruled out. We need you to test everything. And we need to know that this isn't health related. And this before we change any meds, because and they have an involuntary medication order for their psych meds. So we're able to really, I think, advocate with other doctors that like we can't just take them off their medications. Like we really need to rule this out. And we get people who like we take them to the ER, and the ER, probably not your, but they really are dismissive, and then we get them back and our director of nursing, who's amazing, will be like, no, we're taking them straight back, or we're taking them to this other hospital. And we've had people who ended up having emergency appendectomies, or they were in kidney failure, and because they weren't being taken seriously because of their illness, they they could have died. And so even with PC primary care doctors, we have so many people who have sleep apnea, and the assumption is that the psych meds are causing them to be tired and they just need to be lowered down on their psych meds, but it's not always the case. And the risks, you've got to look at the risks and the benefits, and it doesn't do you any harm to rule things out. So actually, for family members, I highly recommend, if your young person or your family member will let you go with them, because you can ask more questions, you can be a witness. And I tend to get kind of feisty with the doctors if they're not willing to do it, and bring up statistics around how much earlier people with schizophrenia die than the regular population, because the doctors do not take them seriously and they do not assess for health problems. And then when I start bringing that up, they suddenly like are willing to run tests.
Yeah. And whether that's fair or not, that is the reality, because if somebody has a significant mental illness, they might not be able to express what they're going through or advocate for themselves. But having severe and persistent mental illness does not protect you from appendicitis. It does not protect you from heart attack. It does not protect you from sleep apnea. So those things do exist. And so to that advocacy and asking questions, this member is just as valid as any other patient in my ER and any other patient in any healthcare setting. And that's why having somebody there to advocate, it makes a difference.
Yeah, even if our individuals are able to advocate for themselves, we'll send somebody with them. We'll let them take control, but they're there just in case. Like just in case they need to argue with a doctor or something, and they're a witness. Like I'm seeing how you're responding to this. I'm going to put this in my notes. What was your name, sir?
Yeah. And it shouldn't have to come to that, but it is. And whether patients are on a cancer journey or a chronic illness, the healthcare system is imperfect. That's why I do this, because it is imperfect and we need to look at all of these different things. And I try and teach people how to navigate it through the imperfections. I would love to say that we're fixing it, but that's a whole nother thing. So as is, how can we survive it, get the care that we need, get your loved one the care that they need, and particularly with, quote unquote, stigmatizing conditions such as mental illness, where you and I both know they're less likely to get that medical care that they need.
Yeah. Especially women and women of color.
Oh,
that's a whole nother topic.
Yes, truly. So now you take a stigmatized condition and then a marginalized population, and it just gets worse and worse. So I love the work that you're doing. So this is so important. The way that you got here through a message of compassion, the fact that you actually prize and want to help these people that so many other people would write off or call difficult. These are your people. And so what you do, not everybody is necessarily in California, but they're going to want to chat with you. They're going to want to learn more about this. Victory starts now. Brooke, what is the best way for people to get a hold of you, to learn more from you, to help their loved ones?
We have a website, victorystartsnow.org. I'm also on LinkedIn. The agency has a LinkedIn profile too, but I think for me, it would be via LinkedIn or my work email.
Fantastic. And we'll drop all that in the show notes for everybody who is listening. So thank you truly for the incredible work that you do. Just any last words of wisdom for people who are trying to navigate this with a family member, trying to do their own self-care, trying to survive?
Maintain hope. As long as we have hope, we can transfer that onto our loved ones. And, they're people recover and they have remarkable recoveries. I know psychiatrists and PhDs and people who've had tons of hospitalizations and come out the other end to do really amazing things. So as long as you have hope for your loved ones, you're going to be able to help them eventually have hope for themselves. And that's going to start them on their journey.
I love that so much. And she's not just saying that because that's the name of the podcast. That's actually their message.
No, yeah, no, hope is
no, like we share that message. It comes through in everything that you do. The clarity, it just happens to be like a perfect fit. I've had patients ask me if Dr. Hope is a fake name, and it's actually not. It's
really
my real last name, yes. But and I love it because it matters, and that's what you give to people. So, Brooke, thank you again so much for sharing with us today. We're so grateful for your time.
Thank you for having me.
Thank you for tuning into today's episode of the Navigating Hope podcast. Before we dive into the key takeaways, I want to share a free resource that can make a difference in your healthcare journey. Red flags and green flags, tools for finding and evaluating your healthcare providers for optimal care. This guide will help you identify trustworthy healthcare providers, ask the right questions, and ensure you and your loved ones receive the best possible care. It's what we do. We help people navigate the healthcare system. It's amazing. This is available for you right now. Now, let's explore these incredible insights by Brooke Barton, a licensed clinical social worker with over 2 decades of experience in supporting individuals and their families, people who are struggling with severe and persistent mental illness. As the director of clinical quality assurance at Victory Starts Now, Brooke has dedicated her career to helping families and individuals navigate the complex mental health system with compassion and effectiveness. So here are those key takeaways. Number 1, the power of compassion in mental health care. Brooke's personal journey into social work was inspired by her family's deep-rooted commitment to giving and by her cousin's early diagnosis of schizophrenia. This experience led her to dedicate her career to supporting individuals with severe mental illness, providing that compassion and understanding that can make a profound difference. Number 2, defining severe and persistent mental illness. Brooke explained that these chronic conditions like schizophrenia, schizoaffective disorder, bipolar disorder with psychotic features, recurrent major depressive disorder, unlike short-term mental health challenges, these illnesses require lifelong management, much like chronic physical conditions such as diabetes. Number 3, family support is essential for better outcomes. Research shows that individuals with strong family support experience fewer hospitalizations and better long-term stability. Brooke emphasized the importance of educating families on how to respond to symptoms, set healthy boundaries, and support their loved ones without going through personal burnout. Number 4, navigating mental health resources in your community. Many families struggle to find the right care options for their loved ones. Brooke highlighted the importance of knowing the local resources, such as psychiatric emergency response teams, behavioral health urgent cares, and organizations such as the National Alliance on Mental Illness, which provides family-to-family support programs. Number 5, addressing stigma and advocacy in healthcare settings. Individuals with severe mental illness often face discrimination in healthcare settings, where their physical symptoms are sometimes dismissed as side effects of their psychiatric condition or medications. Brooke shared the critical role of advocacy, ensuring that these individuals receive proper medical evaluations and care. And number 6, caregivers often struggle with fear that setting boundaries may result in their loved one becoming homeless or unsafe. Brooke encouraged families to focus on long-term independence rather than creating dependency and helping their loved ones develop self-sufficiency while still offering support. If you're navigating the complex world of mental health, finding the right provider is crucial. To evaluate your healthcare professionals effectively, again, please download our red flags, green flags for finding and evaluating a healthcare provider, click the link. It will be in the show notes. And remember, whether you're supporting a loved one through a mental health challenge or advocating for better care, knowledge and compassion are your most powerful tools. Stay hopeful, stay determined, and as always, keep navigating your journey with hope. Thank you for tuning into Navigating Hope with me, Dr. Jamie Hope. It has been an honor to navigate the realms of health and wellness with you today. Remember, in the journey toward a healthier life, knowledge is your compass. If you enjoyed our time together, please share, like, and subscribe to Navigating Hope. Join us next week where we'll continue to empower your health journey, arming you with the wisdom to navigate life's challenges and keep the emergency room in your rearview mirror.
49 faces looked to him in triumph. Over the last 12 months, they had each taken turns and promoted his business for a week at a time, driving over $987,342 in revenue. What if you had a network of 50 centers of influence who promoted your business every week for a year? Grab your copy of the #1 Amazon best-selling book, The Ultimate Guide to Growing Your Business with a Podcast, at 33% off the Amazon price by going to ultimatepodcastbook.com. Again, that website for 33% off the Amazon price is ultimatepodcastbook.com.